Welcome back to the road to City Hall. As the fight plays out in Congress over a Republican health care plan, there are many questions on both sides of the aisle, and that leaves Americans with plenty of uncertainty about the future of the health care system. Joining me now to break down what the debate is all about and what it might mean for New Yorkers, we've got three health experts. Aaron Billups is NY1's health reporter. Jonathan Tasini is a veteran activist who has spent decades working on health care reform. And Diana Furchtgott-Roth is a senior fellow at the Manhattan Institute who served on President Trump's transition team. Welcome to all of you. Thanks for coming in. And I want to start with you, Diana. The president certainly throughout the campaign, certainly throughout the transition, made clear that he wanted to really move on these reform items. Exactly. He had considerably more urgency than the Republican leadership in Congress now, right?
Well, the Republican leadership also wanted to move on it because it's extremely unpopular. Premiums are rising more than people can afford. Companies are dropping out of providing health insurance. In some counties, there's only one health insurance company available. There isn't any choice anymore. So it's clear that something has to be done.
And so the thing that is striking to me is that there seems to be a collision between the urgency with which some kind of repeal and replace is supposed to happen and basically the math, as I understand it, of what this is all going to look like. Because the things that were promised and the things that the House leadership has said are in this first iteration of the bill include things that strike me as just kind of incompatible. That, you know, the employer mandate goes away, but you can still stay on your parents' policy until you're 26. There are tax credits to pay for things, but there's sort of fewer penalties on younger and healthier people to participate in the system. It seems to me that there's going to be some kind of a collision at some point where there just isn't enough money to pay for the things that have been promised.
Well, I think that it's a very good step forward. Some things were obviously left in for political reasons, like children staying on their parents' health plans until the ages of 26, when they are definitely not children anymore. So I think that was politically popular. The pre-existing conditions, that was left in there, with the caveat that if you dropped your health insurance for more than 63 days, you would have to pay a 30% penalty for a year when you re-enrolled. So that was the way to kind of get around that. But I think the idea is fundamentally sound. Just as with food stamps, people who don't have enough income, we give them a debit card and they go to the grocery store and buy their groceries. With people who don't have enough to purchase health insurance above the Medicaid level, we give them an advance refundable tax credit, and they go out and choose the same kind of insurance that anyone else would be able to purchase. And I think that's very important. We don't have classes of insurance for different kinds of people.
Jonathan Tasini, I know you're in the end you're a single payer guy.
Yes,
you know,
that's very important to
however, Medicare for all is not on the table right now. What we have is a bill that tries to sort of unravel, undo, and presumably reform and improve Obamacare. What do you see in this first version of the bill?
Well, I do want to say, though, we do have a crazy healthcare debate. We should have a single-payer Medicare for all system in the way that all industrialized countries do, and I actually have urged CEOs to get behind this because it would reduce costs to business of billions of dollars. I wrote a piece about that, which I'm happy to tweet to people. So the first thing is this should not be called the American Health Care Act. It should be called the Make Americans Sick and Kill Seniors Act, and that's effectively what this will do. With due respect to Diana, the first thing is it's not extremely unpopular. Obamacare, the Affordable Care Act, is actually more popular than it was when it was first signed, and part of that was because of all the town hall meetings that happened in the last several weeks where people poured out from their homes. They were mobilized in large part because of Bernie Sanders to understand that what is going to happen in the repeal. And so here are some actual facts. And it is not a mistake that the Republicans are trying to force this bill through without having it scored by the Congressional Budget Office, because they do not want the American people to know what it's going to cost. CBO did a study just a few weeks ago looking at what this similar bill, not the exact specifics, but essentially the outlines of a Ryan bill would look like. And here's what they said. The number of people who are uninsured under a Ryan-type bill would increase by 18 million in the first new plan year following enactment of the plan. And then later, because what the Republicans want to do is eliminate the Medicaid expansion, then the number would increase to 27 million and then to 32 million in 2026. What we're seeing is an incredible transfer of wealth from the average people back to the rich, because essentially it was funded by, largely the Affordable Care Act was funded by a tax on the very wealthy. And that's the Republican game plan. It's always been true. Shovel as much money to the richest in the country, impoverish the poor. And the last thing I'll say is, for seniors listening to this, this will devastate Medicare. And it's the reason that Joshua Robin actually mentioned this earlier on the newscast. The reason that the AARP is opposing this bill is it essentially will bring the insolvency of Medicare closer. $350 billion over 10 years. And this was a number that was put out by the CBO, independent, will be taken out of the Medicare system and bring the insolvency closer.
Let me ask you this. When you say that, you know, whatever the number was, 18 to 20 million will be uninsured, many of them are healthy people who just didn't want to pay into the system, right? So it's not as if 18 million sick people are now going to be without coverage.
No, well, that's true. It's not sick people, but that's not the way the healthcare system works. As you know, the more you have people in the system, to put it quite bluntly or grossly, the better the system is because the costs are evened out. And as you pointed out, I'm a single-payer advocate, but in fairness to the ACA, before it was signed, there were 49 million people who were uninsured. That went down to 25.2 million. So there are almost 25 million more people who are insured under the ACA that would not have been insured. And that's an important thing societally. And this is the difference, and I'll just say philosophically, Republicans do not care about average people. And what has happened is, if you look at the history of their free market ideology, which is impoverish people through tax cuts, through deregulation. This is just the same playbook. They've always wanted to kill Medicare. They've hated Medicare, and this is another way to do that.
Well, let me ask you how this plays out in New York. We heard a lot when Obamacare came into effect that there was this money hunt. You know, how are we going to pay for things? So there's a special tax on medical devices. We heard endless amounts of complaints from opponents of Obamacare about that. We have our underfunded public hospitals here, which have been sort of teetering on the brink of insolvency for a number of years now. How will this, if enacted, how will this impact New York?
Well, the majority of enrollees under Obamacare in New York State are on it through the Medicaid expansion. So there's 2.4 million New Yorkers who have coverage through the Medicaid expansion. It's pretty much going to freeze kind of where it is under the House plan if this goes through. And that means they'll be able to keep their coverage. But Medicaid is known for what's known as churn, so people drop in and out of coverage, say if they're seasonal workers or they get a lot of overtime and their income goes up over that threshold of about $16,000 a year. And under this plan, once they get out of that threshold, they won't be able to be covered under Medicaid anymore, and then they won't be able to get back onto that plan. And I don't know at this point if the incentives, if there's enough incentives to get people to buy an additional plan, because New York has been known for its very stringent policies for insurers. It's always been very expensive, and if you're healthy and you may not want to use that tax credit to buy insurance.
On Medicaid, I just want to correct.
Until 2020.
You're absolutely right.
You have a couple of years for it.
But here's the difference. Under the Affordable Care Act, the federal government said, we will pay 100% of the Medicaid cost. Under the Republican plan, they are going to move eventually to block grants. And we know, this is just a fact, this is historical, the block grant...
It's a 90-10 split,
But the block grants will never, ever cover maybe it will in New York, but in other states, it's just a fact, and this is one reason that the AARP is opposing it.
We don't know what the block grants are going to be.
Well, we know.
They have
come
not
on,
been set
we know that Republicans historically will underfund those block grants so they do not cover people. It's just a fact. We can debate numbers. Millions of people.
It's certainly something to be concerned
Millions
about.
of people won't be insured.
Let me ask you this, Diana. At the time,
and if I can just say one more follow-up, after they go off Medicaid, when their incomes rise, then they go onto the refundable tax credit system, where they can go and purchase insurance. And I think it's an important thing to notice that there was an Oregon study that said that there was no difference in outcomes of people on Medicaid and people who are uninsured. So being on a traditional insurance.
The Kaiser Family Foundation recently just came out with a sort of breakdown of how much states will be getting according to this plan. And they estimated that New Yorkers will see probably anywhere between 25 to 50% less in tax credits compared to what they were getting through the Affordable Care Act. So it's not sure that that will be enough of an incentive for people to actually purchase insurance.
There's going to be a lot of there's going to be a lot of competition among these insurance plans. People are going to be able to, companies are going to be able to issue different kinds of plans, and the different kinds of plans and the competition.
But we already saw that system. It didn't work.
Is going to bring the price down.
Well, why were there so many people uninsured prior to Obamacare?
Hold on. We are out of time. I do want to ask you one last question, though. Is reducing or even breaking the back of the medical inflation that has been driving so much of the problems in the past, is that part of I haven't heard that as part of the discussion. Is that part of the goal here?
Definitely. With the expansion in the health savings accounts, the expansion in the flexible spending accounts, people are going to be able to do more shopping around, and prices are going to go down, just like they have gone down for LASIK eye surgery and cosmetic surgery. There's also going to be the advantage of not having the employer mandate, so employers won't have a disincentive to employ people.
Okay, we are going to leave it there for now. We're at the start of a big, complicated debate, but we've got the outlines of it now from a lot of different points of view, and thank you so much for coming in tonight.
Thanks very much.
All right, we're going to take a short break now. Straight ahead in our political rundown, Curtis Sliwa and Herson Barrero sound off on Mayor de Blasio's lofty plan for 5-borough ferry service. That and more straight ahead.